الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Now we are discussing influenza and influenza vaccine. I mean influenza and influenza prevention. Professor Mahmoud Hani Suleiman. Influenza. It is a highly infectious viral illness, first pandemic in 1580s, at least 4 pandemics in 19th century, around 21 million deaths worldwide in pandemic of 1918. This is at least. Some authors say it is 50 million, others say it is 200 millions. Virus first isolated in 1933. Influenza virus, single-stranded RNA virus, also Myxoviridae family. 3 types, A, B, C. Subtypes of type A determined by hemagglutinin and neuraminidase. Influenza virus strains, type A, type B, type C. Type A, moderate to severe illness, all age groups, humans and other animals. Type B, milder disease, primarily affects children, humans only. Type C, rarely reported in humans, no epidemics. This is the influenza virus sketch showing how the nomenclature of this virus. See here, type of nuclear material. Type of nuclear material. This is the virus type, fusion. This is the geographic origin, 411 strain number, 2002 year of isolation, H3N2 virus subtype. H3N2 virus type. This is the neuraminidase, and this is the hemagglutinin. This is the neuraminidase and this is the hemagglutinin. Influenza antigenic changes. This is important. Influenza antigenic changes, hemagglutinin and neuraminidase antigens change with time. Look here, you will see many resemblance with COVID-19 changes due to point mutations in virus gene or exchange of a gene segment with another subtype of influenza. Impact of antigenic changes depend on extent of change. More change usually means larger impact. There is a shift and drift. What is a shift? A shift, antigenic shift is major change, will lead to new subtype due to exchange of gene segments. So shift is due to exchange of gene segments. May lead to pandemic. So shift is a major change. Pandemic. Example, what happened in 1957? H2N2 virus. What happened in 1968? H3N2 virus. Drift. Antigenic drift is a minor change. And drift is a minor. Drift minor. Caused by point mutations in gene may lead to epidemic. Example of the drift. What happened in 2002? H3N2 virus. And what happened in 2004, the so-called fusion virus. Drift explained. I will explain the problem more. Each year's flu vaccine contains 3 flu strains, 2 A strains and 1 B strain. 2 A strains and 1 B strain that can change from year to year. After vaccination, body produces infection. If body produces infection fighting antibodies against 3 flu strains in vaccine. يبقى after vaccine 3 antibodies against these 3 strains. If vaccinated individual exposed to any of the 3 flu strains, antibodies will latch onto virus. HA antigens preventing flu virus from attaching to healthy cells, so not infecting these cells. So the vaccine is good. Influenza virus genes made of RNA are more prone to mutations than genes made of DNA. Because influenza genes are made of RNA, they are more prone for changes than DNA genes. If HA antigen changes shape, antibodies that normally would match up to it no longer can do so. This will lead to newly mutated virus to infect body cells. This type of genetic mutation is called antigenic drift. This is a drift. This sketch to explain what I have said. Print it and study it well. Here I'm going to explain antigenic shift. Genetic change that enables flu strain to jump from one animal species to another, including humans, is called antigenic shift. So the shift allow influenza virus to jump from one animal series to another. Antigenic shift 1, aquatic bird passes a bird strain of influenza A to intermediate host as pig. A person passes a human strain of influenza A to same pig. Viruses infect the same cell. Genes from bird strain mix with genes from human strain lead to a new strain. New strain can spread from intermediate host to humans. This explain the antigenic shift. يبقى from the bird go to the pig, from the human go to the pig. These inside the pig mix and make a new virus. Influenza type A antigenic shifts in 1989. It was moderate severity of pandemic. Pandemic in 1918, it was severe. Pandemic in 1957 was severe. 1968 moderate. 1977 mild. Impact of pandemic influenza. 200 million people could be affected. Up to 40 million require outpatient visits. This is the impact. Up to 700,000 will be hospitalized. This will prevent the hospitals from taking care of ordinary diseases. About 2,000 deaths will happen. Impact of pandemic influenza in 2010 pandemic. In 2009, influenza A H1N1 pandemic was first in 21st century. Lasted April 2009 to August 2010. There were more than 18,000 deaths. On basis of modeling study from CDC, estimated this pandemic influenza associated with more than 150,000 and 57.5 deaths worldwide. Accordingly, this is in 2009 and this is 2010. Accordingly, public health authorities developed plans for pandemic response to pandemic influenza. Influenza of swine or avian origin. 1. Humans of all ages occasionally infected with influenza A viruses of swine or avian origin. Human infections with swine influenza viruses, symptoms and signs are as typical influenza like illness. Human infections with avian influenza viruses are uncommon but may lead to a spectrum of disease from mild respiratory symptoms, conjunctivitis, to severe lower respiratory tract disease, acute respiratory distress syndrome, and death. Most notable among avian influenza viruses are H5N1. Among avian influenza, noticed H5N1 and H7N9, both associated with severe disease, high case fatality rate. Influenza A H5N1 viruses emerged. Here is another expression, emerged. They are emerged disease, emerged as human disease in 1997, and then human disease in Asia, then caused human disease in Asia, Africa, Europe, and Middle East, where these viruses present in domestic or wild birds. لهذا عند حدوث وباء تتم مراقبة مزارع الدواجن بل والطيور المهاجرة، وإذا أصيبت الدواجن يتم إعدامها ولا يسمح بذبح الداجن خارج المجزر، وأي عامل لابد أن يستخدم ملابس الوقاية الشخصية ويفحص جيدا وتحلل إفرازاته للتأكد من خلوها من إنفلونزا الطيور. So when an epidemic occurs due to avian influenza, the poultry farms are observed. If one of these poultry had influenza, it is terminated and it is not allowed to do slaughtering for this poultry outside the slaughter. Any worker has to use personal protective equipment, personal protective devices, personal protective clothes, and examined well for be sure that his excretions and secretions do not contain avian influenza. Influenza of swine or avian origin, H7N9 at 2013 in China. Asian H7N9 highest potential pandemic risk. No efficient or sustained human-to-human transmission detected. This is electromicrograph of avian influenza A H5N1 in gold and growing in median Darby canine kidney epithelial cells in green. Avian influenza A viruses do not usually infect humans. Pathogenesis of influenza, respiratory transmission of virus, replication in respiratory epithelium with subsequent destruction of cells, viremia rarely documented viral shedding in respiratory secretions for 5 to 10 days. Influenza clinical features, incubation period 2 days, severity of illness depend on prior experience with related variants. So if the human has prior experience, it will be less severe. Abrupt onset of fever, myalgia, sore throat, non-productive cough, headache. Influenza complications. Pneumonia, either secondary due to bacterial or primary due to influenza. Ray's syndrome, it is a fatty infiltration and dysfunction of liver. Acute encephalopathy, this is due to use of aspirin, especially in children in if he had influenza. So my advice is not to use aspirin in any fever in children or infants. Also, from the complications, myocarditis death may reach up to 1 per 1,000 cases. Isolation of hospitalized patient. This is how to deal with cases. This is the containment of a case. Standard precautions and droplet precautions. We took two lectures for these two subjects. Please read them again. Standard precautions and droplet precautions recommended for children hospitalized with influenza or influenza-like illness for duration of illness. Respiratory secretions considered infectious and strict hand hygiene procedures used. Also, there was a lesson for hand hygiene. Influenza diagnosis on clinical and epidemiological characters. Here we like to explain. When an outbreak or epidemic of a disease occurs, we do not wait till confirmation by laboratory examination. On epidemiological background, we diagnose the disease to begin preventive and control measures and to begin treatment. Isolation of influenza virus from nasopharynx, throat, and sputum. Significant increase in influenza IgG by serologic assay, direct antigen testing for type A virus. Here is treatment and prophylaxis by antiviral drugs for influenza. Here is the drug name: Tamiflu, Relenza, Amantadine, Rimantadine. يبقى Rimantadine, Amantadine, Relenza, Tamiflu. This is how to use them in treatment among who, and this is for who it may be used as a chemoprophylaxis. Okay? Some of them can be used on infants. Complications of influenza in adults and children. In children, the commonest one, otitis media, secondary bacterial pneumonia, primary viral pneumonia. In adults, also otitis media, secondary bacterial pneumonia, primary viral pneumonia, for less myositis. The others are rare. Here is Ray's syndrome in children, which is rare. This is the groups at higher risk for influenza complications. Please print this slide and study it well. Please print this slide and study it well to use it in your clinic or hospital. Epidemiology of influenza, reservoir, human and animals, as we said. Type A only. Animals type A. Transmission, respiratory, or probably airborne. Temporal pattern, peak December, March, in moderate climate. May occur earlier or later. Communicability, 1 day before to 5 days after onset of disease. Influenza vaccines. They are numerous. Here we will talk about inactivated subunit, TIV, intramuscular or trivalent, inactivated subunit. We leave attenuated, either intranasal or trivalent. Inactivated influenza vaccine efficacy may reach 90% among those older than 65 years. Maybe 40% effective among frail elderly persons, 60% effective in preventing hospitalization, which is important to prevent hospitalization, so the hospitals can work. 80% effective in preventing death. Live attenuated efficacy in healthy children may reach 87% effective. Also 27% against otitis media, 28% reduction in otitis media with accompanying antibiotic use, decreased fever and otitis media in vaccine patients recipients who developed influenza. Live attenuated efficacy in healthy adults. 20% fewer severe febrile, 24% fewer febrile, 27% fewer lost work days, 80% to 37% fewer days of healthcare worker visits, may reach about 45% fewer days of antibiotic use. Timing of inactivated vaccine. Actively target vaccine available in September and October to persons at increased risk of influenza complications, children under 9 years, and healthcare workers. Vaccination of all other groups in November. This is due to little supplement. Continue vaccinating through December and later as long as vaccine is available. Influenza vaccine schedule. Age group till from 6 to 35 months. Dose is quarter of a milli, 1 or 2 doses. 3 to 8 years, half a milli, 1 or 2 doses. More than 9 years, half a milli, 1 dose only. Inactivated influenza vaccine recommendation. 50% year of age or older, 6 to 23 months of age, residents of long-term care facilities, pregnant women, persons 6 to 18 years receiving chronic aspirin treatment. Here aspirin again. So protect them against influenza, so they are not given aspirin with influenza. Persons more than 6 months of age with chronic illness. Inactivated influenza vaccine recommendation continued. Chronic illnesses like pulmonary, cardiovascular, metabolic, renal dysfunction, hemoglobinopathy, immunosuppression, including HIV infection, decreased respiratory function or handling of respiratory secretions. Healthcare workers, including home care, employees of long-term care facilities, household contacts of high-risk persons, providers of essential community services, students, persons traveling outside, anyone who wishes to reduce the likelihood of becoming ill from influenza. You see, it is very near the recommendations for COVID-19 vaccination. Live attenuated influenza indications, 5 to 49 years, close contacts, persons who wish to reduce their own risk. Adverse reactions of the inactivated influenza vaccine. The most important are local reactions, which may reach 20%. Live attenuated influenza vaccine adverse reaction, children and adults. Children, no significant increase in upper respiratory tract fever and other. Significantly increased risk of asthma or reactive airway disease in children, especially 12 to 59 months. Adults, significantly increased rate of cough, runny nose, nasal congestion, no increase in occurrence of fever, no serious adverse reactions identified. Inactivated influenza vaccine contraindications, severe allergic reaction to a vaccine or vaccine component, moderate or severe acute illness. Live attenuated influenza vaccine contraindications, children under 5 years of age, persons more than 50 years of age, persons with chronic medical conditions, children and adolescents receiving long-term aspirin therapy. Live attenuated influenza vaccine contraindications and precautions to immunosuppression from any cause, pregnant women, severe anaphylactic allergy, history of Guillain-Barré syndrome, moderate or severe acute illness. This is important. Live attenuated influenza vaccine storage and handling must be stored in a temperature less than minus 15 degrees centigrade, may be stored in frost-free freezer with a separate door, may be thawed in a refrigerator and stored at 2 to 8 degrees centigrade for up to 60 hours only before use. Should not be frozen after thawing. So after thawing, بعد ذوبان التطعيم من الحالة المتجمدة إلى الحالة السائلة should not be refrozen again. This is table of influenza vaccines available in the 2017 season. This to show, I put this only to show how many vaccines, how many variant vaccines are present, and their dose is different, and the ages to which they can be given is different. So choose the vaccine carefully. Please print this table and use it in your clinic or hospital. I put this picture only to show the administration of nasal spray flu vaccine. Influenza surveillance as a method for prevention. Monitor prevalence of circulating strains and detect new strains. This is done in Western countries, and not only this, there are also stations all over the world to do this, to be sure that there is no an epidemic of influenza. And these stations are now monitoring also COVID-19. Monitor prevalence of circulating strains and detect new strains, estimate influenza-related morbidity, mortality, and economic loss, rapidly detect outbreaks, assist disease control through rapid preventive action. Antiviral chemoprophylaxis. Only oseltamivir and zanamivir given. Only oseltamivir and zanamivir given. They are given where risk of influenza the aim is to risk of influenza lowered but still remains, and susceptibility to influenza returns when medication is discontinued. You must instruct those who are taking this chemoprophylaxis that risk of influenza is lowered but still remains. Susceptibility to influenza returns when medication is discontinued. Given to high risk children at risk of complications of influenza vaccine, where influenza vaccine is contraindicated. Family members on unimmunized healthcare workers for control of influenza outbreaks as a supplement to immunization may be given with immunization. Can be given post-exposure for children also at high risk and for healthcare workers. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you for your listening.